This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, as parents, we know there are certain things we just shouldn't give our children. For instance, hard candy for fear of choking, or we know not to let them play with scissors. Well, think along the lines of medicine. If our kids are in pain or have a cough, most of us know that codeine is off limits, but a new study shows many kids are still given the powerful painkiller. In fact, more than 500,000 kids visit the emergency rooms each year. Now, according to the study, which was published in the journal Pediatrics, only 3% of those kids' ER visits resulted in children being prescribed codeine. But with more than 25 million pediatric ER visits each year, the study's authors say even 3% is too many. So what are the dangers and what can be done to stop this? Well, joining us today to share some insight on this new study is pediatrician Heather Collins with Peninsula Regional Medical Center. Thanks for joining us this afternoon.
Thank you.
Now, national guidelines urge against giving children codeine. So why is this happening?
Well, since the mid to late 1990s, public health officials had started to warn healthcare professionals about some of the dangers regarding codeine, and it came to our attention when in studies we realized that children who had gotten their tonsils and adenoids taken out for obstructive sleep apnea, they were seeing occasional deaths in children who had received Tylenol with codeine after their surgeries. Later, it was elucidated that the likely reason behind these deaths was that there were genetic traits of these children who died that caused them to metabolize codeine faster into morphine. So codeine has to be metabolized by the liver into morphine to then become an effective pain reliever or analgesic. And the issue with codeine is that its effects can be unpredictable, dependent upon your genetic makeup and how your liver metabolizes this.
Well, so what are some of the dangers of prescribing codeine? I mean, you mentioned what happens, but what are some of the things you see?
Okay, some of the things you see would basically be what you would see in a narcotic intoxication. Okay, so some of those things you would see excessive sleepiness, slowed breathing. Complications after surgery would include this slowed breathing, and in rare cases, death. And the real danger with codeine, if you metabolize it to too high a concentration of morphine, it slows your breathing to the point where you may stop breathing altogether.
Okay, so is there an alternative? What are the alternatives?
The alternatives for pain relief, ibuprofen is a fantastic pain reliever and has been shown in studies to be equally effective to codeine because, again, codeine has different effects in different people. Hydrocodone is also a great alternative for pain. It is also in the narcotic family. However, hydrocodone is in its active state and doesn't need to be metabolized. So you have, as a physician, you have a lot more control over knowing how much medication you're prescribing.
Right. So a lot of adults take codeine for pain. What is the age that, can teenagers start taking it? Can it be prescribed to them, or what is the age?
Honestly, because there are so many other safer alternatives available, I don't think there's really any reason to use codeine at all. In fact, some children's hospitals will see children from infants up until 18, and in some chronic care cases into their early 20s, do not have codeine on their formulary, which is the list of medicines for the hospital, at all to prevent its use. So honestly, it's really not a necessary medicine.
Okay, so if your doctor prescribes it, ask for an alternative?
I would. I would, and I think that many doctors are likely aware of some of these discussion points, but sometimes practice can take a while to change. So I think a simple request would be very easy.
All right. Okay. Dr. Collins, thank you so much. Just be proactive. And if you would like to learn more about PRMC, go to delmarvalife.com and click on the show tab. And as if there aren't enough things to worry about when it comes to our kids, here's something else. Measles, mumps, whooping cough, childhood diseases are making a comeback. Up next, we find out why and how you can protect your kids. How about this for thought? Protecting your health by eating pumpkin. We're going to find out why it's considered a superfood year-round. We're even getting a few pumpkin ideas the whole family will love. Delmarva Life will be right back.